Okay, we're gonna it's another lecture regarding the survey of diseases. We're going to talk about something that's called Mycobacterium tuberculosis. Very interesting organism. When I was in graduate school for microbiology, this is actually one of the labs that I actually worked in during my laboratory rotations. Very interesting. So TB is what we're going to talk about here. Now, in this picture right here, you can actually see like these little fuchsia-looking cells. That's bacteria. That's actually the tuberculosis. All right, Mycobacterium tuberculosis. So that's the actual tuberculosis bacteria right there. These other guys are part of the white blood cells actually flocking to that area trying to fight off the infection. All right, so we're going to just talk about tuberculosis. So tuberculosis basically is our bacteria that particularly infects the lungs. It can spread to our other parts of the body, but particularly infects the lungs because it is a respiratory disease. All right, so pass through airborne droplets. So if someone is TB positive, they may be coughing. That's one way to transmit it. And we call this actually, so it's airborne. And we call it through airborne droplets, right? So they're actually little droplets of the bacteria that's, floating around these droplets. And that can be inhaled, all right, because we inhale through our nose and mouth, get inside of a person, and the potential of it starting a disease. Now, not always will it, but the potential definitely of it starting the actual clinical tuberculosis disease within this recipient. Okay. Some symptoms of tuberculosis are loss of appetite, fatigue, that's just kind of tiredness, chest pains, coughing, coughing up blood, that could be definitely one, prolonged coughs, night sweats, so on and so forth. So I don't want you to, I don't know, oh my gosh, I'm tired, I got tuberculosis. No, it's actually, you have to kind of more so, it's a number of these type of things that will point to the possibility of a patient having TB. All right. This is from the CDC, Center of Disease Control, located in Atlanta, Georgia, government agency that actually looks at diseases, track diseases, and so on and so forth in the United States. Almost 10,000 TB cases in the United States reported in the U.S. in the year 2015. Now, again, I want to actually underscore and just highlight reported. All right. Do I believe is actually large in terms of people in the U.S. during that year is larger than 9,557? Yes. Yeah, there are more people than that. So that's why they said reported. Okay, there's some people who probably just had it, maybe went to go and got checked out, but for some reason that wasn't reported, or it slipped through the cracks, or someone who maybe just was at home suffering from tuberculosis and just didn't seek medical attention. Unfortunately, that does sometimes happen. All right, again, here is bacteria right here, tuberculosis bacteria. That's it. Another picture of, again, they're fuchsia in color. All right, and then these are the white blood cells. And you're like, well, white blood cells, how come they're purple or bluish? Because it's the stain. Because white blood cells are white. That's why they get their name. And if they were not stained, and the tuberculosis actually bacteria, it's stained as well. If they were not stained, then you would not be able to see it underneath the microscope. Again, TB, yet again, and this is actually under what we call a scanning electron microscope. So that's actually what the tuberculosis bacteria looks like. That's looks like probably like a macrophage that has engulfed TB, but then they're able to grow inside the macrophage and escape it and spread to other cells. Interesting picture. just from a historical perspective, many years ago, before antibiotics, it was a big, huge push to fight against TB. So you see this kid with boxing gloves, help fight tuberculosis. Hunters die of consumption. Consumption is kind of more so like an old school term. That's really TB. Gosh, it's kind of hard. Sorry, it's kind of hard to guide this mouse. I wanted to underline it though, but it just kind of covered it. But anyway, consumption. Okay. And historically, they had signs all throughout society saying, hey, no spitting. Okay, so that was signed and decided that no spitting. That's from the Virginia Anti-Tuberculosis Association. Spitting on the floor car, all right, could result in a $500 fine. That was a lot of money back in the day, or a year in prison, or both. Why? Because basically when people would spit, some of those tuberculosis cells will be in the spit and on the ground, and those cells are called, we call acid fast. So those cells can actually remain alive and infectious for up to 9 months. So that's basically can be a healthcare nightmare. So if they saw someone spitting, in that spit, of course, your saliva is made up of saliva, which is meaning water. That's going to evaporate long gone, but the bacteria cells that in the picture that you saw previously, they can remain where that spit landed there for up to 9 months. That's a long time. That spit. Again, do not spit on the floor. So yeah, so they were quite serious. Again, this was before antibiotics, before we discovered antibiotics to fight against the bacteria. Even on cobblestone bricks, all right, then etch that in. Oops, do not spit on sidewalks. So on cobblestone bricks, sidewalks and streets, do not spit. People who had tuberculosis were sent off to sanitariums. Okay, and that's where they stayed pretty much until a lot of people died. I don't know exactly what the benchmarks were to see if someone actually survived it and got better, and they let them out. I'm sure that was rare, but yeah, but they just had to remove you from society and place you somewhere. It's Montana Sanitarium, place you somewhere to remove you from society, so that basically for the good of the society, to keep people alive, to decrease the number of deaths associated with TB. There's another one. I kind of like history, so I'd like to kind of incorporate some history with some things as well. This is a postcard from Utah State Tuberculosis Sanatorium. So I don't know if a person sent that postcard to maybe a family members that, hey, I'm here at the Utah State Tuberculosis Sanatorium. Wish you were here. I don't know if it went like that there, but yeah. It's a picture of basically back in the early 1900s, they thought that sunbathing cured tuberculosis. So these are patients actually like in a sunroom of one of the sanatorium, and they laid them out in the sun, thinking that would clear the tuberculosis. It's another thing. Okay, put them on the porch, and of course we might think, oh my gosh, that's crazy, that's nuts. Why would they do that? That's beyond something that's thinkable. Well, again, remember that's a little over 100 years ago, and that's basically where our understanding of medicine was. I'm sure, in 100 years from now, people are going to look back at, oh my gosh, what were you guys thinking back in the year 2018? Are you serious? You guys thought that this would cure that. So yeah, so it's all relative. Another picture. This is in Maine. All right. So TB tests. Basically, here the test, we call it PPD, purified protein derivative. So that's what we call the PPD test, purified protein derivative. All right. And again, the skin test to see if someone, basically the skin test for tuberculosis. This patient showing a positive test. Now, here's the thing about it there, folks. You having a positive test does not mean that you have tuberculosis. A positive test simply means that you've been exposed to it. And after that, they have to do additional things like x-rays or sputum sample. So a positive test simply means that you've been exposed to it. That is what it looks like. Okay, we call colonies. That's what tuberculosis looks like when it's growing basically on an agar plate in the laboratory. It's another picture of it in a test tube, okay, on a special agar. That's what it looks like. And here are some of the medicines. Medicines or anything that's used to fight against tuberculosis: isoniazid, rifampicin, ethambutol. All right, and then here's another one there, right? Isoniazid, rifampicin. All right, pyridoxine, ethambutol. So, a number of times with patients, we call it short course chemotherapy, but actually, a patient will have to take these pills, all 4 of them, from anywhere from 6 months to 2 years every day. It's very hard to kill tuberculosis. So take these pills anywhere from 6 months to 2 years every day. All right, depending upon the doctor and what the doctor thinks it's actually best. It's a long period of time. There is a vaccine called BCG, Bacillus Calumet-Guerin, named after 2 French scientists, Calumet-Guerin. However, we do not give BCG out in this country, in the United States of America. Basically, it's just, I guess, the U.S. philosophy as to not to give out BCG. Number one, if a person gets BCG, you will have a positive TB test. And then you have to do the x-rays and sputum sample. Number two, BCG can be maybe anywhere from 0 to 80% effective, so that means that it very well may not work at all. And number three, some believe that there could be a back mutation issue associated with that. All right, another BCG. And back mutation simply means that, I guess, in general, with some vaccines, I mean, there's different kinds of vaccines. Some are live vaccines, some are heat killed, some are attenuated, some are protein products. But with what we call live attenuated, it might be, say, maybe like a virus or bacteria. And I'm just saying in terms of vaccines in general, if it's live attenuated, it simply means that, hey, although it's rare, it can back mutate and actually give you the disease that vaccine was designed to prevent you, that was designed to prevent in your body, right? So that's the lecture on tuberculosis. Thank you.